Mr. Lucas for 5 minutes.
Thank you, Mr. Chairman. And Dr. Zotek, thinking about Dr. Sell's comments, let's begin from the parochial perspective, being your neighbor up north in Oklahoma. As of last night, the State Department of Health reports there are no confirmed positive cases of coronavirus in Oklahoma as of yesterday evening, although one Oklahoman showing symptoms is waiting on the test results from CDC. Can you discuss for a moment what we can share with our constituents back home to not instill panic and how to stress the importance of reasonable steps to prevent the spread? Yes, Doctor.
Peter Hotez. I know Oklahoma pretty well. My son graduated from OU, so just last year as a petroleum engineer. So it was a great place. We love Norman.
Absolutely.
The issue is this. I think in an attempt to calm public fears, you're hearing things like it's a mild illness, this is like flu. It's not really the case because this is an unusual virus. For many young people especially, it is a mild illness, but we're seeing some devastating things. And we got a heads up about this from the Chinese. They actually informed us, and we knew it was coming. Nursing homes. Look what this virus did in that nursing home in Kirkland, Washington. It rolled through it like a train, right? It's at least 7 deaths so far in a nursing home of about 100 people. So this is like the angel of death for older individuals. We need to go back and support all of our nursing home. I don't know what we're doing wrong, but clearly that nursing home is not prepared for this, and I'm going to guess nursing home across Oklahoma's are not prepared as well. Also, our healthcare providers. We saw in Wuhan 1,000 healthcare providers got sick, and we had at least 15% severely ill and in ICUs. And that is very dangerous because not only do you subtract those people out of the healthcare workforce, but the demoralizing effect of colleagues taking care of colleagues is going to be devastating. I mean, the whole thing can fall apart if that starts to happen. We saw this with Dallas. So I was on Governor Perry's task force for infectious disease, and those 2 ICU nurses, when they got sick, it was really devastating. And finally, the governor had to call the Health and Human Services Secretary, CDC director, said, look, normal ICUs can't take care of these patients. We've got to get them out of here. So you don't want to see those kinds of situations. I'm worried about our first responders. We're already seeing in Washington State how they're already in quarantine. So does that mean we're going to have to bring in the National Guard? I think that's going to be another big issue as well. So those are the 3 vulnerabilities that I see right now in a place like Oklahoma.
And how should our constituents back home react to that, the average JQ public out there?
Well, I think the average GQ public needs to hear from its elected leaders, from the governor, from the public health authorities on what the plan is. I mean, don't just get up there and say this is a flu, this is a mild illness. One, it's not true, and people in Oklahoma are pretty smart. They'll figure that out pretty quickly. And second, explain what the risks are. These are the 3 vulnerable populations that we have to worry about, and here are the steps that we're doing to mitigate that. That's what people will appreciate.
Dr. Murray, as you mentioned in your opening statement, approximately 75% of emerging infectious diseases originate in zoonotic pathogens. You estimate there, you said 1.7 million unknown viruses yet to be discovered, around half of which are capable of infecting people. Could you expand, elaborate on the current state of research to improve surveillance in these diseases and where gaps may exist now as we look towards the future about addressing future challenges?
Yes, thank you very much, and I also appreciate that while we're trying our best to address the topic at hand of a lot of ill people, we do need to be thinking of the next virus and the next virus. I also think that the CDC has done a wonderful job of looking at and studying human health, and if we're going to do our best job to prevent future viruses from jumping, I think one of the missing components is indeed wildlife health. If 75% of the viruses come from wildlife, it makes sense that we look at that juncture of both wildlife and human health. We also, this virus is termed a novel virus, right? It's new. It's new to the people. I don't think it's new to the bats, and that's right. That's an important point. And then some of our other colleagues here have been talking about modeling and how important that is. Modeling gives us a greater information now as to what COVID will be doing within the U.S. and within other countries. We also have groups of modelers who look at the forefront, the stages before emergence, and look at the data that we have to try and determine where are the hot zones, what are the risk factors, and behaviorally, what are people doing to put themselves in danger. Those are really, really important ways for us to get ahead of the curve and catch the viruses before they come out. As part of the team that we've been on, which is a USAID program called PREDICT, we have a team of modelers who look at viral emergence, and they're able to determine for each different virus how many, as we collect more and more data, what percentage of the viruses that we know are characterized, and how many more are likely to be out there. Latest estimates are less than 1%, of the viruses we know are less than 1% of the viruses that are out there, meaning there's over 99% viruses in wildlife waiting to jump into humans. That's staggering, and that's really one of the things that we need to look at.
Thank you, Mr. Chairman. My time's expired.
The gentlelady from Oregon, Ms. Bonamici, is recognized for 5
Thank you,
minutes.
Dr.